Thoracic outlet syndrome is a very common injury, or at least symptoms that people get. We've got two main types of thoracic outlet syndrome that we can focus on. First one is called neurogenic or neurological thoracic outlet syndrome, and the second one is vascular. If you're suffering from a neurogenic type of TOS, you will be suffering from nerve compression up into the brachial plexus. So the brachial plexus is a bundle of nerves that comes out of the cervical spine and parts of the thoracic spine, and then goes all the way underneath the clavicle here, on the way down into the fingers. We've got three main nerves here: the median, ulnar, and radial, and a lot of other nerves such as the axillary or the musculocutaneous nerves, and all these nerves are providing function to the upper and lower arm all the way down to the fingers, and obviously the shoulder and some of the pectoral area. Now this region is very easy to compress because of posture, because of too much repetitive movement on one side of the body. Weight lifting sometimes can also cause it because of the growth of the muscles around the neck, but mainly we need to focus on the fact that there's nerves that are being compressed underneath the clavicle here. So one of the main muscles that is causing this compression most of the time, it's something called the scalene. So the muscles that come out of the cervical spine here that descend down underneath the collarbone or the clavicle into the first and second ribs. Because of the proximity of these muscles to the nerves, it's very common for them to start putting pressure on these nerves, and then if there's any pressure up here, then people will start to feel pain around the shoulder, numbness, tingling sensations all the way down into the fingers. Other symptoms that you might feel are weakness in the fingers and lack of strength when it comes to gripping. When it comes to a vascular thoracic outlet syndrome, we can expect the following symptoms: discoloration of your hand and arm pain and swelling, potentially due to blood clots, lack of color in one or multiple fingers in the hand, an obvious weakness in the pulse of the entire arm, coldness in the fingers and hand, weakness in the muscles of the arm and hand, and a throbbing sensation around the collarbone and all the way into the arm. Before we continue with this video, I wanted to show you guys quickly the Omnibody Academy website. If you go onto the website and click on one of the courses, you're going to find a lot of free information onto the main page of the course there. As you can see, there's a couple of videos that will show you what the course is all about. If you go all the way down, you're going to see that there's a couple of buttons there that allow you to create a free account, which is nice and easy. Once you've logged in, you're going to get videos on anatomy, how to understand pain, where pain is coming from, and also different self-treatment techniques which will allow you to treat your own pain, followed by corrective exercise techniques. There's no upfront cost there. We just want you guys to enjoy the free trial, and hopefully it's useful for you. Now let's get on with the rest of this video. Now I don't need to say that if you've got the second type of the thoracic outlet syndrome, the vascular, you need to straight away go and see a doctor. If you're suspecting any of the symptoms that I've just described, you need to get yourself into a hospital a bit, because this could be very dangerous. Now when it comes to the neurogenic type of TOS, it's something that sometimes we can actually treat ourselves. Having the symptoms of a condition don't actually mean that you have the condition itself. A lot of people will suffer from tightness up into the clavicle here, or lots of sensation sometimes into the fingers, or coldness. This doesn't necessarily mean that you have thoracic outlet syndrome. You might just have symptoms of the condition due to compression of the muscles on top of the nerves. If you manage to notice this quicker, then you can stop it from becoming something more serious. This is where taking care of these muscles on a day-to-day basis with self-treatment and exercise is vital, because you can prevent this from happening. If you're suffering from any sort of neurological symptoms such as loss of sensation in the fingers or tingling in the fingers, then there's specific techniques that we're going to learn in this course, which you're going to use every day to alleviate these symptoms.